watching News Channel 11 at 5:30.
Welcome into News Channel 11 at 5:30. I'm Sarah Diamond. Josh Smith is off tonight. We are continuing to monitor the latest numbers locally in the COVID-19 pandemic. 6 new COVID-19 related deaths were reported in our region today. Sullivan County, 2 new deaths. Carter, Hawkins, and Washington County, Tennessee, and Smith County, Virginia each reported 1 new death. Ballad Health reports 98 patients in their hospitals with confirmed cases of COVID-19. 15 of those patients are being treated in the intensive care units. 8 patients need to be on ventilators. 10 patients are hospitalized while awaiting their test results. Well, joining us once again live via Skype is Ballad Health Chief Infection Prevention Officer Jamie Swift. And Jamie, after a dip in those numbers a couple of weeks ago, they're back up, but seem to be steady, more or less. What trends are you seeing here in our region?
Yeah, our hospitalization numbers are steady right now. I am concerned by some of the trends that we're starting to see. We're starting to see, a lot of positives in people who work in jobs that are interacting with the public a great deal. And so that really tells me that we're starting to have probably a lot of community spread, even more so than we've seen. So I'm concerned by some of the trends. We're seeing our numbers go up. We're seeing our daily cases worked go up. We're seeing that within the state as well, within most states. And so typically what we know is that cases start to increase, our hospitalizations will follow that again in a couple of weeks.
I know we have talked about pediatric cases the last couple of times that you've been here with us. Do you see any trends as far as pediatric cases are going?
We've not had any additional hospitalizations. We continue to work a few pediatric cases each day, but those that somewhat to be expected as you have this community spread, as you have these events. So nothing that is beyond the ordinary as far as hospitalizations.
I know that nursing homes and long-term care facilities have really had a rough time. What are you seeing? Is there anything different in the trends as far as those facilities go?
Those seem to really be leveling off some, so I think some of those are beginning to come under control. Our hospitalizations from nursing home patients have gone down. We still have some, obviously. There's still some ongoing spread in some of those nursing homes. That's such a vulnerable population. When one case gets in there, it's very likely that you'll have more. So I'm hoping that those are starting to really slow down across the region.
And there's a group of people that we don't get to talk about much, but we should, and that's our healthcare workers, our frontline workers. They're exposed, depending on where they are, every day to not only COVID-19, but pretty much everything else that is trending in our region. How have you seen an uptick of cases as far as our medical professionals go, or how is that trending?
Obviously, Ballad Health is one of the largest employers in the region, so we have had cases. Most of those we trace back to community spread. So anytime that we have a healthcare worker that's infected, we do the full interview. We try to determine source, and then we look at their contacts as well as far as notifying anyone that needs to be notified. We've had cases. We've not seen large outbreaks, thank goodness. I'm very proud and confident of the PPE supply that we have at Ballad Health. And so within our facilities, I feel like we're doing a really good job protecting our healthcare workers.
One thing that we've talked about for several weeks now is the beginning of flu season along with COVID-19 and the push for people to get their flu vaccine and get it early just so they're protected from at least one of these things that could possibly happen. Are you seeing people taking this to heart and getting their flu vaccine? What have you seen so far?
Yeah, I don't necessarily have a lot of numbers on flu vaccine. I talk to a lot of people, if I run into you, I may ask you if you had your flu vaccine. Starting to hear people talk about it. I've talked to some who have never gotten the flu vaccine before who were actually going to get one this year. So and that's really the populations I want to reach, those people who have never done it. But if we can get them to join those of us who get vaccinated every single year to get vaccinated this month and really help protect our community, I think it's going to make a difference.
Do you think mask wearing is going to help with the maybe curb the spread of the flu, since a lot of people are still choosing to wear masks?
I think so. A lot of it is dependent upon, are we wearing masks correctly, and is the majority of the population wearing masks? So I do feel like people are getting a little tired of masks, and a little frustrated. And so it's really important that we continue to keep wearing those masks, wearing them appropriately. If we do that, that's when we'll see the impact that it'll have on flu as well.
We talked about antibody testing as well, and folks seem pretty excited about the possibility of that antibody testing helping people who are getting the virus. What is the status of that right now?
Yeah, our program is going really well. I'm, so proud of our region. We've had multiple people who have survived COVID who have stepped up and donated their plasma. We've collected over 700 units. It's really, moving to me to see people who have survived this, who in turn will turn around, take time to make those donations and help those people who are going to need it in the future.
Chief Infection Prevention Officer Jamie Swift of Ballot Health, thank you so much for joining us. Some great information.
Thank you.